I want you to stop scrolling for the next few minutes because what I'm about to walk you through could genuinely save your life, or the life of someone you love. Colon cancer almost never announces itself with pain. It sneaks in through tiny, forgettable changes, the kind you brush off as stress, aging, or just a bad week for your stomach. And here's the part that should really grab your attention. This used to be something we mostly worried about once someone hit their 60s or 70s. Now, according to the American Cancer Society's newest report, colorectal cancer is climbing fastest in adults in their 20s, 30s, and 40s, rising about 3% every single year in that age group, while it's actually going down in people 65 and older. Nearly half of all new cases are now showing up in people under 65, and that share was only about a quarter of all cases back in the 1990s. This year alone, doctors expect well over 150,000 new diagnoses in the United States and more than 55,000 deaths, and roughly a third of those deaths will be in people younger than 65. So today, we're covering 10 early warning signs your body may already be sending you, quietly, patiently, waiting for you to notice. Think of this as a checklist you can actually use, not just something to scroll past and forget, because I promise you, the person who watches this all the way through and actually remembers even 3 or 4 of these signs is in a completely different position than the person who scrolls past for something more entertaining. This isn't meant to scare you for the sake of scaring you, it's meant to arm you, because a body that's trying to tell you something deserves an audience that's actually listening. Sign number 1 is anemia, plain old low iron in your blood. Doctors call it iron deficiency anemia, and it means your body can't make enough healthy red blood cells to carry oxygen where it needs to go, which is why you feel drained for no obvious reason. The connection to colon cancer comes down to slow, hidden bleeding somewhere in your digestive tract. If bleeding happens higher up, say in your stomach, it tends to move fast and show up as black, tarry stool that's hard to miss. But if it's happening down in the colon, it's usually a slow trickle, so slow that you could be losing tiny amounts of blood for months, even years, without ever noticing a single trace of it in the toilet. Why does this happen at all? Tumors are sneaky little operators. They build their own private blood supply through a process called angiogenesis, and those brand new vessels are thin, fragile, and poorly built, so they bleed easily, even when nothing dramatic seems to be going on. This is why a routine blood test showing low iron, especially in a man or a woman past menopause with no obvious explanation like heavy periods, is one of the first things a good doctor will want to chase down. Sign number 2 is fatigue that just won't let up, the kind where a full night's sleep and a weekend of rest doesn't fix a thing. That anemia we just covered plays a role, but there's more happening under the hood. Tumors release chemical signals called cytokines that can interfere with your mitochondria, the tiny engines inside your cells that produce energy for everything you do. The frustrating part is that this fatigue gets waved away constantly, chalked up to stress, poor sleep, or just getting older, when it might actually be your body waving a flag that something deeper needs attention. If you find yourself needing naps you never used to need or dragging through afternoons that used to feel normal, it's worth mentioning at your next checkup instead of pushing through it. Sign number 3 is a subtle darkening of your stool, not bright red, just quietly darker than what's normal for you. This happens when that slow, hidden bleeding mixes in with your stool as it travels through your system, giving it time to change color before it ever reaches the toilet. It's easy to miss with the naked eye, which is exactly why simple at-home stool tests exist, because a lab can detect blood your eyes simply cannot. Here's something else worth knowing. This kind of bleeding can come and go. A smooth, easy bowel movement might not disturb a fragile tumor at all, but a little constipation, a little extra straining, and suddenly there's bleeding again, which is part of why this sign is so easy to dismiss as a one-time fluke. Sign number 4 is a real, lasting shift in your bathroom habits, meaning your stool becomes noticeably looser or harder than what's typical for you, and it sticks around for more than a couple weeks. Your gut has its own nervous system, sometimes nicknamed the second brain, packed with nerve cells that control muscle contractions, blood flow, and digestive enzymes. A growing tumor can physically press on that system or throw it off balance with inflammation and chemical signals, which changes how much water your intestines absorb, and that swings your stool consistency one way or the other, depending on the day. Quick pause, because I know some of you are already Googling your symptoms with one hand and reaching for the popcorn with the other, so do me a favor and hit that subscribe button, because your colon and I would both really appreciate the company, and honestly, we don't ask for much. Sign number 5 is bloating, gas, and feeling full way too fast. Sometimes after just a few bites of a meal you'd normally finish easily. A tumor growing inside the colon can partially block the passage, trapping gas and forcing digested material to work its way around the obstruction. Things slow down, And when digestion slows, fermentation increases, which feeds the wrong kind of bacteria and produces even more gas than usual. Your body may also start signaling that you're full simply because your digestive system is struggling to keep up, not because you actually ate enough calories. If you're the kind of person who used to clean your plate and now you're pushing food away halfway through and it's been happening for weeks, that pattern deserves a second look. Sign number 6 is something called tenesmus, which is really just a fancy medical word for a constant, urgent need to go, paired with a feeling that you never fully finished, even seconds after you just went. This is a classic early clue for tumors near the rectum or the lower part of the colon, called the sigmoid colon, because that area sits close to the stretch receptors responsible for telling your brain it's time for a bowel movement. When a tumor takes up space there, it can trigger that same urgent stretching sensation, even when there's nothing left to actually pass, which is exhausting, frustrating, and honestly, a pretty miserable way to live day to day. Sign number 7 is stool that's consistently thin, like a pencil, not just once in a while after a rough night, but regularly, week after week. This happens when a growth narrows the passage enough that stool has to physically squeeze past it and change shape just to get through. A lot of people who are later diagnosed say, looking back with hindsight, that they noticed this thin stool for months before anything else felt wrong, and they simply assumed it was diet-related. Sign number 8 is a more dramatic swing between constipation and diarrhea, back and forth, with no clear pattern or trigger you can point to. A partial blockage can cause backup and constipation, and in response, your irritated bowel may release extra water to help push things through, which then flips into diarrhea a day or two later. To be fair, this exact pattern shows up in far more common and far less serious conditions, like irritable bowel syndrome or inflammatory bowel disease, so please don't panic and self-diagnose from a video. That's not what this is for, but it is absolutely worth mentioning to your doctor, so it can be properly ruled in or ruled out. Sign number 9 is visible blood either in the toilet bowl or on the toilet paper. And yes, this one tends to get people's attention fast because it's impossible to ignore. Bright red blood usually means the bleeding is happening close to the exit point, so it hasn't had time to darken on its journey out. It can also mean heavier bleeding from a larger, more fragile tumor, since cancerous tissue tends to be disorganized on a cellular level and prone to breaking down as it grows larger. Now, before anyone spirals, hemorrhoids are by far the single most common cause of blood in the toilet, and statistically, that's exactly what it usually is, but the only way to actually know for sure is to get it checked by a professional instead of guessing at home and hoping for the best. And sign number 10, the one doctors consider a louder, later stage warning, is rapid, unexplained weight loss, meaning you're not dieting, not exercising more than usual, not doing a single thing differently, and the number on the scale keeps dropping anyway. Tumors can release chemical signals that suppress your appetite, trigger inflammation that breaks down muscle tissue faster than your body can rebuild it, and even speed up your metabolism to a point where you're burning through energy reserves you're not replacing at meals. Add in a tumor that's actively stealing nutrients as it grows larger, plus a digestive system that's no longer absorbing food properly because of the disruption, and you end up with a body that's essentially working against itself. In advanced cases, doctors call this wasting pattern cachexia, and it's a signal that the situation needs medical attention right away, not another week of waiting it out and hoping things settle down on their own. Let me paint you a picture, and just so we're clear, this isn't any one real patient. It's a composite of stories doctors hear over and over. Picture someone in their late 30s, busy job, 2 kids, running on coffee and stress. They start noticing they're more tired than usual, but hey, who isn't tired with a schedule like that? A few months later, they notice their stool looks a little different sometimes, a little softer, a little harder, nothing consistent enough to worry about. They chalk it up to a new diet, a stressful quarter at work, maybe a stomach bug that never quite left. Fast forward another year, and now there's some cramping, some bloating after meals that never used to bother them, and they've quietly stopped finishing their plate at dinner without really noticing they'd stopped. By the time they finally go in because a friend mentioned blood in the toilet isn't normal, the cancer has had well over a year, sometimes closer to 2, to grow undisturbed, simply because every single sign looks small enough to ignore on its own. That's the pattern doctors see again and again, not one dramatic symptom, but a slow accumulation of small ones that nobody connects until it's later than anyone would like. Now let's talk about what you can actually do about all of this, because awareness without action doesn't help anybody. Screening options today are honestly better and more comfortable than most people assume. A colonoscopy remains the gold standard because it lets a doctor see the entire colon and remove polyps in the same visit before they ever get the chance to turn into something dangerous. But if that idea makes you nervous, there are less invasive options too, like an annual fecal immunochemical test, sometimes called a FIT test, which you can do privately at home, or a stool DNA test that checks for genetic markers of cancer cells every 3 years. None of these options require you to be symptomatic first. In fact, the entire point of screening is catching this before you ever notice a single one of the 10 signs we just went through, because localized colon cancer caught early has a survival rate above 90%, while cancer caught late after it's spread drops dramatically. That gap between catching it early and catching it late is almost entirely about timing, and timing is the one thing you actually have some control over. So why is all of this happening more in younger people right now, when it used to be almost unheard of before 60? Researchers point to a mix of factors working together over years, sometimes decades, before any single symptom ever shows up. A steady worldwide decline in gut bacteria diversity, more widespread antibiotic use starting from childhood, a diet dominated by ultra-processed food, far less daily movement thanks to desk jobs and hours of screen time, chronic stress that never really switches off, and rising rates of obesity and metabolic disease, all of which quietly damage the gut environment long before anything feels obviously wrong. None of this means you did something to deserve it. It means the environment around all of us has shifted and our bodies are still adjusting. Let's bring it all together now, because there's genuinely a lot to remember here. So here's your full recap in one place. Sign 1, unexplained anemia or low iron that shows up on a blood test with no clear cause. Sign 2, deep fatigue that doesn't improve with rest, sleep, or time off. Sign 3, stool that's subtly darker than what's normal for you, sometimes terry looking. Sign 4, a real and lasting change in bowel habits, either looser or harder than usual, sticking around for weeks. Sign 5, bloating, gas, and feeling full after just a few bites. Sign 6, that urgent, incomplete feeling called tenesmus, needing to go constantly without real relief. Sign 7, stool that's consistently pencil thin, not just occasionally. Sign 8, alternating bouts of constipation and diarrhea with no clear pattern. Sign 9, visible red blood in the toilet or on the toilet paper. And sign 10, rapid, unexplained weight loss with no diet or exercise change behind it. None of these signs on their own automatically means cancer, and honestly, most of the time they don't. They're usually something far more common and far less scary. But when they show up together, or they linger for weeks without any obvious explanation, that's your body politely, then not so politely, asking you to pay attention. The single most effective thing you can actually do with this information is get screened starting at age 45, or earlier if you have a family history, because a colonoscopy doesn't just detect cancer, it can physically remove precancerous growths before they ever get the chance to become a real problem in the first place. That's the whole game here, catching this early while it's still boring, still quiet, still just a stool test or a slightly awkward doctor's appointment, instead of catching it later when it's loud and demanding and much harder to treat. If this video opened your eyes even a little bit today, do yourself a favor and share it with someone in your life who needs to hear it, because you genuinely never know whose life this information might end up changing. I'm Dr. Christopher. Thank you for spending this time with me today. Take these signs seriously, take care of that gut of yours, and I will see you in the next one.